Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
More than 1 million NHS workers can expect pay rises if they agree to a deal struck between most unions and ministers. It follows a pay cap imposed for the last 5 years and a pay freeze before that. The deal will see wages increase between 6.5% and 29% over the next 3 years, with the exception of doctors, dentists and senior leaders. The biggest rises will go to those on the lowest end of the scale, cleaners, porters and catering staff, who'll see an immediate £2,000 added to their pay packets this year. The salary increases are expected to cost around £4 billion, but they won't come out of the NHS budget. They'll come from the Treasury instead. Our political editor, Laura Kuhnsberg, reports.
Porters, paramedics, nurses who care for millions of patients. The staff who keep the NHS going are finally to have a bigger pay rise.
It's nice for us to be recognised for all that hard work, but obviously it doesn't detract away from the last few years where we actually haven't had anything.
Most of us live on a strict budget. That can ease off a bit, and future will look better and brighter.
I have two young children, so having this pay rise will help out even more with childcare, things like that, be able to do more things.
For 5 years, there have been calls to do just that. Aside from some automatic rises, the limit on public sector pay increases of 1% meant wages fell behind.
Secretary of State for Health and Social Care, Secretary Jeremy Hunt.
And the election left the Tories in no doubt about the irritation. So
today's agreement on a new pay deal reflects public appreciation for just how much they have done and continue to do. Rarely has a pay rise been so well deserved for NHS staff who have never worked harder.
When a nurse pleaded with the Prime Minister for a pay rise on national television, she was told there was no magic money tree. So can he tell us how this pay rise will be paid for? Has the Prime Minister's horticultural skills grown said magic money tree?
taxpayers' money for the rises will come from the Treasury to start with, not out of existing health budgets. So the big unions are on board.
It's not solved the problems, it's a start. And we would expect it to be the start of a new process that recognises the hard work of our nurses and our people who work in our health service, that recognises the value and that we value those people for what they do.
But staff still have to approve the deal, and with inflation, it might not make up the difference.
I think the devil is in the detail, and our members that met yesterday were absolutely going through the details and couldn't see how this was going to claw back years of pay cuts.
Perhaps for NHS staff in England, these rises can't come fast enough. Remember, limits on pay have been in place for years, part of the Conservatives' efforts to balance the nation's books. But public money will still be tight. This is an easing of a squeeze, not the end. Scotland and Wales are likely to follow the Westminster move, and it adds volume to calls for rises in other parts of the public sector. Money round here is still tight, but the cap no longer fits. Laura Kuhnsberg, BBC News, Westminster.
More than 1 million NHS workers in England, from cleaners and porters to senior nurses, are being urged to accept a new pay deal. The government described the 6.5% increase over 3 years as a significant offer. Some midwives and physiotherapists will be among those getting the biggest increases. The package, agreed with most of the unions, now goes to a ballot of health workers. One union, the GMB, says it's jam tomorrow. And with inflation still high, it's just a sticking plaster. Here's our national editor, Allegra Stratton, on the government's NHS remedy.
It's been a long 7 years of flatlining pay, while the pressure on NHS staff has just gone up and up. After bitter protest and the worst winter ever for the health service, finally today, a pay rise. In pay negotiations settled this morning, the Treasury found a substantial £4.2 billion of new money. The Health Secretary hailed the deal.
I think they are some of the hardest working people in this country.
They've been working unbelievably hard over probably the most difficult winter anyone can remember. So this deal is a recognition of that hard work.
The deal affects 1.3 million workers in England, from nurses to midwives, ambulance drivers to porters and admin staff. They'll receive increases from 6.5% to 29% over 3 years. It will see the lowest starting salary, for example, someone like a cleaner, increase from nearly £15,500 now to more than £18,000 by 2021, a 17% increase. 13 of 14 unions back today's deal, but accept it could have been more generous.
Of course, it's not as much as we would like for everybody in the NHS. We always think our members deserve more. But what today represents is a significant step forward, a fully funded pay agreement from the government, who have failed to invest in our NHS.
But one union, GMB, will advise their members to reject it.
The devil is in the detail, and the details tell us that 52% of the total NHS workforce are only going to see a 6.5% increase in their pay over 3 years. Put that against where inflation will be over the same period.
This afternoon, Scottish and Welsh governments said they hope to strike similar pay deals. In England, there are many questions about NHS funding still to be resolved, how to pay for social care and the day-to-day running of the service. But today, with the arrival of spring, a thaw in the pay freeze for NHS staff too. Allegra Stratton, ITV News.
The new deal marks an end to a 7-year pay cap for some of the country's most vital workers. It's designed to support and retain staff at hospitals like Hillingdon in West London. Our social affairs editor Penny Marshall heard their reaction.
It's not been too bad for you, though, has it?
No. As news of the pay increase spread through England's hospitals, those caring for others were trying to work out just how good the good news really was for them. Here at Hillingdon Hospital, everyone had a different story. Ava Price is a healthcare assistant and has been with the NHS for 3 years. Her salary will go up by around 20% by 2021, which is around £3,200.
It will really help me very much, because trying to buy a house, if I didn't get this increase, I would be still on whatever I would be on. So I am well pleased for it, because personally, it is going to be really helpful to me and my family.
Mary Sampson has been with the NHS for 2 years. Her pay will increase by around 15% in the next 3 years, a rise of around £2,300.
I work 37.5 hours a week, which I enjoy every bit of it, I must add first. And it can be from dealing with somebody collapsing on the floor, to serving a plate of food, to pushing a wheelchair. You always try to go above and beyond your job, always. So whether they give you £5 for a day's pay, you're still going to do the same job. But it is make a difference to get the extra. It will make a difference to me.
Sarah McDonough, a matron, has been in the NHS for 22 years. She'll get an increase of 13% over the next 3 years, which is around £5,300.
I think all hospitals nationally have had quite a busy winter. I think we're no exception, and I think we have worked extremely hard. I think I can put my hand on my heart and say I'm very proud of what my staff did. My staff went over and above.
For staff here, the reaction has been largely positive, although because of the pay freeze, this pay rise has been a long time coming. And because it's being spread over several years, it's also being spread quite thinly. Potentially, if all the I's are dotted and the T's are crossed, NHS staff could see their pay increases start as early as July. Penny Marshall, ITV News, Hillingdon Hospital.
And our national editor, Allegra Stratton, is with me live. Now, they all have their views. They all have a ballot. Will it get through?
But they were all positive in that piece, so it looks like it will go through. Yes, as you've heard, one union, GMB, is unhappy with it. On its own, it's not large enough to scupper the deal, and 13 of the other 14 unions are happy. Now, some of their members over the next few months could think, oh, actually, some of the points that were raised in my piece about inflation and so on, it's not that generous. But I think that they will be in the minority. I do think that this will go ahead.
And, of course, 1.3 million health workers, NHS England. What about other public sector workers?
I don't think that they will be as lucky. We have heard the National Union of Teachers today coming out and saying that they would like 5% too, but the people in government that I have spoken to suggest that I don't think that there will be many following suit. One Treasury source said to me today, this today is about showing that this government is unashamedly pro-NHS. Another one said that this is the big deal. There will not be other big deals coming soon.
All right. Allegra, thank you.
Now here, more than 1 million NHS workers in England are being offered a pay rise of between 6 and 29% over the next 3 years. It brings to an end 7 years of pay freezes and has today been recommended by 14 health unions, although not the GMB. It is also being funded by the Treasury, despite the Prime Minister's claim during the general election that there was no magic money tree. Our health and social care correspondent Victoria MacDonald reports.
I was in shock this morning.
Susan Owenama had just come off night shift when we met up today. Her fatigue levels dramatically improved by the news of her pay rise.
It should have happened some years back. I have to do extra shifts just to make ends meet. You know, I could hardly go on holidays with my family, my kids. So it's good news.
A psychiatric mental health nurse, Susan is in line to receive just over 24% over the next 3 years.
We've come a long way.
This brings to an end 7 years of pay freezes and is a deal between the unions and NHS employers that seems to have been made with relative ease.
This framework that's been put out for consultation contains changes that will benefit all of the different people in the NHS. So that's the people you see, the porters, the cleaners, the midwives, the OTs, the nurses, but also those that you don't see, the medical physicists, the clinical scientists, the administrative staff.
Early government briefings about pay linked to improved productivity also seem to have been toned down. Now it's about recruitment and retention.
I think for employers, it is about creating a system, a pay system that makes us as competitive as possible in the longer term job market. We expect that job market to be a bit more challenging after we leave the European Union, and we believe that this positions us really, really well in terms of competing with other parts of the economy to attract the brightest and the best to come and work in the NHS.
About half will receive 6.5% over 3 years, while the other half will see their salary increase by between 9 and 29%. Cleaners, porters and catering staff currently on the lowest salaries will get 15% more on payday.
The agreement which NHS trade unions have recommended to their members today is a something for something deal, which brings in profound changes in productivity in exchange for significant rises in pay.
This is also a victory for the Health Secretary Jeremy Hunt. For a long time, he could not seem to persuade Number 10 that there was growing anger over the public sector pay cuts. Then there's the bonus that in the autumn statement, the Treasury said that they would pay the £4.2 billion cost of these pay rises. So it will not come out of the hard-pressed NHS coffers.
The GMB union is not recommending the deal, which is for England only. But 14 other health unions are optimistic that their members will agree to the proposals, with the hope that the money will be in their pay packets in July.
Victoria MacDonald reporting.
I've been getting away with it all.